With the previous bracket that I was using, the system was such that we would have a patient in and put the initial finishing wires in and usually plan on making a few adjustments for individual tooth idiosyncrasies. Unfortunately, when the patient came back, we would find that we'd need to make another adjustment due to the amount of play within the bracket. So that lack of control at the end has been a shortcoming for many years now, and I kind of grew to live with it. About a year and a half ago or so, I was introduced to the prototype for the SLX brackets, and many of the frustrations that I had on a daily basis were addressed in the engineering of the brackets. So I agreed to try a few, and lo and behold, the clinical outcomes matched what the engineering expectations were. And so recently I decided to switch my entire practice over. With the SLX bracket, we have more control because the tolerances are tighter. So along with the individual bracket widths, which improve the rotational control, we also have better in-out control for final positioning of lower incisors and the anterior teeth. So it's just a smoother finish, and I find myself making far fewer adjustments than I've been making over the last several years. And the staff were delighted with the outcomes because it was much easier on them placing wires at perhaps 1 or 2 bends as opposed to a half a dozen.
These ridiculous bends that they have to put in here is a nuisance. Sometimes those bends can be a little crazy. They can, have to rotate the tooth, do a bunch of torque on the teeth. You could have anywhere from 10 to 15 bends just in one wire. So switching to the SLX brackets for an orthodontic assistant should be a no-brainer. All you do is you simply close a door. The wire stays in there. The doors never come open, and there's less emergency appointments, less visits, easier for the patient. So comfort-wise, everything's great. The finishing results with the SLX brackets, when they get to their final appointment, they have maybe 3 adjustments. We have patients that are finishing that are already in treatment for about 11 months, and they're about to get their braces off. So for us and for the patient, they have 3 long appointments, and then they're done.
Of the patients I've finished so far, it's really been a nice change. I can still remember the very first one. I had 2 bends. Another patient had 2 bends in the upper and 1 in the lower. I mean, that's the sort of thing that just makes everyone happy. I look at the bottom line as to how many visits a patient has to come in and whatnot. And if the patient is told how long they're going to be in treatment and that's when they finish or a little bit early, then we have happy patients. And as the old saying is, a happy wife is a happy life. Well, the parallel is that happy patients is a happy practice.